Kronowitz, and welcome to What's Hot in Plastic Surgery. I'd like to talk about facial rejuvenation in this segment. There's much that's talked about facial rejuvenation. I'd like to try to categorize it for you into several basic steps. You could talk about non-invasive techniques, which really involve the use of Botox and filler agents. These really, and sometimes really are not being used properly. They're just injected in various places in the face. It really should be much of an art form, and in combination with using both the filler and the Botox together, especially to fill volume and fillers in the upper face and the use of Botox in the lower face. This leads to a very rejuvenated appearance. This type of non-invasive method obviously needs to be redone and is really used mainly for maintenance. However, in some patients could be their main form of facial rejuvenation. As we kind of go up the ladder of complexity, but yet still not complex, then we talk about minimally invasive techniques, for instance, which can be done usually under light sedation or sometimes local anesthetic. And this involves the use of autologous fat grafting or the harvest and injection of stem cells and fatty tissue into the face in order to restore volume and to rejuvenate by providing fresh tissues and new blood supply and fat cells to the face in order to improve the skin and the tone of the skin as well. In addition, this is often combined in my practice with acid pills with a light TCA peel, which will also lead to a rejuvenation of the skin, especially on the superficial layers. As we go down into the most complex, which is the surgical rejuvenation, which is really taking on some very interesting aspects. I like to think of it as both the upper and mid-face. The mid-face really is the cheek area, but that's how we tend to refer to it. This basically involves the eyebrows area, the brow area, around the eyes, and the malar or the cheek area. We have several different techniques that involves the use of brow lifting, the use of eyelid work, both the upper eyelid and the lower eyelid, which really can have different needs, and the way we approach these various tissues have changed over the years. Instead of taking out so much, we tend to restore and to leave more skin behind. And as well as the cheek area, where we try to add volume, which can be done in several ways. All of this will lead to a nice rejuvenating appearance in the upper face. When we refer to facelifting, often this can be confused, but essentially what we're talking about is the skin of the cheek area and the neck. In order to deal with a complicated neck that has a lot of excess skin, really this is the way to go. And the facelifts tend to focus on the cheek area or the malar area and the neck in order to get some of the laxity, usually by a deep layer lift. We use some of the deeper layers below the skin level in order to lift the face up and all those descended tissues that tends to happen with aging. In addition, we lightly trim any excess skin, and we do a neck lift, and we tighten the muscles in the lower neck, which leads to that rejuvenated appearance. Of course, the facelift and the upper mid-face are often combined into one procedure, which really can restore the entire face. But of course, patients have different needs. And the various techniques that I talked about, from the non-invasive, minimally invasive, and the surgical rejuvenation, can be combined in various approaches and combinations. In addition, with very good skin products, can lead to a long-term facial rejuvenation and a healthy, youthful appearance of most patients.